Well, good afternoon, everyone, and welcome to our August installment of our Genoa Educational Series. This month, we're focusing on the 2025 to 2026 vaccine education. With me today is Bill Wrigley, PharmD. He's the Product Director for Immunizations for Genoa Healthcare. He's a pharmacist by training, has been with Genoa for 16 years, holding multiple roles in operations, and has led the vaccine program for the past 4 years. His favorite part of working at Genoa is that throughout his career here, the focus on improving outcomes for underserved individuals through high-touch, individualized, tailored services has not changed. So without further ado, I'll hand the meeting over to Bill, and Bill, take it away.
Thanks so much, Dana. All right, we will take a brief look at today's agenda. We'll start off talking about adult vaccination rates in the general population. Then we will take a closer look at vaccination in the SPMI population, SPMI standing for severe and persistent mentally ill. Next, we'll take a look at some updates for 2025 flu and COVID vaccines, and then finish up with recent updates to pneumococcal vaccines. First, taking a look at adult vaccine rates in the US population. These key data points come from the 2022 National Health Interview Survey. NHIS is a continuous household survey. CDC conducts interviews in a sample of households to monitor the health of the US population. The first statistic that jumps out is that only 1 in 5 adults is up to date on ACIP recommended vaccines. Among Black and Hispanic adults, rates were even lower. Next, as you can probably guess, vaccine coverage is generally lower among adults without health insurance. For example, when looking at pneumococcal vaccine coverage, insured individuals were 3 times more likely to be up to date than uninsured individuals. And lastly, adults without a usual place to receive healthcare services are less likely to be up to date on recommended vaccines. For example, when looking at the Tdap vaccine, adults who reported a usual place to receive healthcare services were 25% more likely to be up to date than those that did not have that regular place. Next, taking a closer look at the SPMI population. Again, those are individuals with severe and persistent mental illness. These individuals have a higher incidence of chronic physical comorbidities and mortality compared to the general population. Some of those comorbidities, such as metabolic syndrome and diabetes, place them at a higher risk for vaccine-preventable illness, such as pneumococcal disease. And while that's the case, these individuals also have decreased access to non-psychiatric healthcare services. Factors such as lack of a place to receive consistent care, difficulty engaging with the healthcare system, think transportation or difficulty securing an appointment, and concerns about costs of care can cause barriers to receiving preventative care. Now, what if we were able to offer vaccine services where SPMI individuals receive psychiatric care? A 2019 study found positive results by providing vaccine clinics at a CMHC or community mental health center in collaboration with the county health department. At the beginning of the study, participants listed these common barriers, such as lack of awareness of the need for vaccine, accessibility issues, and personal cost as barriers to vaccination. These are consistent with barriers that this population faces in receiving preventative care overall. During the study, 9 vaccine clinics were held over a 2-year period. You can see here that several key categories saw increases of 25% over baseline, such as the hepatitis A and B vaccine, MMR, and Tdap. Influenza and pneumococcal vaccines also saw increases in rates over baseline, though not at that 25% threshold. At the end of the study, participants indicated a positive view of vaccines and an intention to remain up to date with the adult vaccine schedule. 93.8% of participants indicated this, when initially it was only at 58.4%. Taking this to the real world, I recently had a conversation with a pharmacist at one of our Tennessee sites. They were presented with an individual who was transient, uninsured, and staying at a shelter affiliated with the clinic. The individual saw a sign at our pharmacy about the shingles vaccine. Our pharmacist was able to use resources to obtain the shingles vaccine at no charge for the consumer. It is very unlikely, in my opinion, that this individual would receive the vaccine had we not been able to offer the service where they also received psychiatric care. Now taking a look at flu vaccines for the 2025-26 season. One of the main things to note is that ACIP is still recommending all individuals 6 months and older receive a flu vaccine in the 2025-26 flu season, unless contraindicated. They have asked that all flu vaccines be provided as a single-dose pre-filled syringe presentation, no more multi-dose vials. Manufacturers have assured the healthcare industry that supply will not be a problem. Another note, for the 2025 season, all flu vaccine will again be trivalent. There are no quadrivalent presentations of flu vaccine. This was changed in 2024 when ACIP voted to remove the influenza B Yamagata lineage component of the flu vaccine, as it was no longer in circulation in the US. Adults 65 and older are still preferentially recommended to receive a high-dose or adjuvanted flu vaccine. If, however, a 65 or older individual presents for immunization and the high-dose or adjuvanted vaccine is not available at that time, they are still recommended to receive the standard vaccine. Lastly, because flu vaccines are still listed in the adult and children vaccine schedule from CDC, we anticipate that coverage should remain broad for these vaccines. Unfortunately, at this time with COVID vaccines, there's considerable uncertainty. Currently, ACIP and FDA have not supplied any formal guidance on the use and indications for 2025-26 COVID vaccines. Because of variance in state laws that describe a pharmacist's authority to administer vaccines, those forthcoming recommendations from ACIP and FDA may change how pharmacists can provide them. At Genoa, we are closely monitoring communication from the FDA and CDC and will work swiftly to ensure our teams have appropriate guidance once they are released. For clinicians who may be looking for alternative resources in understanding what's appropriate for patients, organizations such as the American Academy of Pediatrics, AAP, and the American College of Obstetricians and Gynecologists, ACOG, are publishing their own guidance. Lastly, let's take a look at some recent updates to pneumococcal vaccines. The primary change is that the age recommendation was lowered to individuals 50 and older. Previously, that had been 65 and older. That opens up a significant percentage of the population that is now indicated to receive a pneumococcal vaccine. I'd also highlight that CDC continues to recommend pneumococcal vaccines for individuals aged 19 to 49 with a risk condition. These risk conditions can include immunocompromised status, diabetes, alcoholism, cigarette smoking, chronic heart disease, chronic lung disease, and others. As we talked about earlier, the severe and persistent mentally ill population has greater risk of some of these comorbidities and may be indicated to receive a pneumococcal vaccine when they are above the age of 19. I did want to highlight a couple products due to ease of use. Both the Prevnar 20 and Capvaxive products only require one dose and the series is complete. Other products may have additional doses required depending on some complex clinical decision making. And with that complex clinical decision making, I'd like to highlight the Pneumorex VaxAdvisor app from CDC. This app, available in both iOS and Android form in the App Store, is very useful for clinicians navigating complex clinical decision making choices when deciding which pneumococcal vaccine is right for an individual patient. With that, I appreciate everyone's interest in today's presentation, and please be on the lookout for additional topics in the months ahead. Thank you.
Excellent. Thank you, Bill, and thank you so much to all of you for watching our August Clinical Education Series presentation. As a reminder, all of our video recordings are available on our YouTube channel that can be accessed at www.genoahealthcare.com/center-partner-resources. Please check back toward the end of September for our next presentation. Our September topic is mitigation of acute suicidal ideation tendencies. Thank you all so much and have a great rest of your day.